What the actual... job?
Hello and welcome back to What the Actual Job, where I interview people about their careers so high school students can gain a better understanding of the jobs they'd like to pursue in the future. Today's interview is with Sophia Gocan, a nurse from the Ottawa Hospital.
My name's Sophia Gocan, and I've been a nurse for 28 years, actually. And the role I was going to speak about today is the one that I worked the last 20 years. I started out my career kind of in neuro and brain surgery and spinal cord care. But then after about 5 years of working in a step-down unit, I started working in an area called stroke prevention. It's kind of like prevention of heart attack, but instead for the brain. The area I worked in was an outpatient clinic, so people were living in their home and in the community, but they had stroke-like symptoms, speech problem or a vision loss, and they ended up going to their family doctor or the emergency department to say, hey, this really strange thing happened to me, but it only lasted 10 minutes or half an hour and then it got better. Working to figure out, well, why did that happen? Why did they have a blocked artery happen temporarily in the brain, and what can we do to prevent it and prevent a serious stroke where they may be left with permanent paralysis or language problems, for example. Another part of the nursing role was actually then to look at all the results of the tests as they came back and make sure the highest priority patients were still getting seen first. And then probably the majority of my job is like spending time with patients and families in clinic. We work in partner with a doctor, so the nurse and doctor see each patient together and kind of review what the symptoms were, what their risk factors are, and we did a lot of health education.
That's really interesting. I did not know that stroke prevention was a niche of nursing. That's so cool.
Yeah.
What would you say is a typical day for you with this career?
The first hour or two actually involves kind of looking at these referrals that have come in and deciding what else a person needs. So making sure every patient kind of receives equal care. And then I would say the other 5-6 hours of my day would be in clinic with patients, seeing about 8 patients and families a day, just kind of meeting with them, going over health history, and then talking with them more about why their particular stroke may have happened and what they can do to prevent one in the future.
And then what would you say is your favorite part about being a nurse, and like what makes you want to come to work every day?
Well, I would say it's the patient interactions, like the day-to-day interactions with people that are most satisfying. I always try to really listen to what people bring with them in terms of their concerns. When I was at the bedside or in this clinic role, kind of listening to what people need and want and trying to fill that gap. So as a nurse, you spend a lot of time with people, so you get to know them quite well and also have this kind of unique ability to help them maybe navigate something they need in the community or just do some health education so they feel more knowledgeable about their condition and more in control of what's happening. And that means a lot to people.
Yeah.
Those are the most rewarding things about it, just that you get to spend that time with people and can help them kind of take control of their health and live their best life.
And then what would you say is the hardest part about being a nurse?
I'd say there's 2 things that I think are maybe a challenge for the profession. So one thing is that it's not static at all. It's not like you go to nursing school and you learn what you need to know and then you just do it for the rest of your life. Healthcare is always changing. There's always new information. There's new best practices all the time about like, oh, we used to do it like this, but we don't do that anymore. This way's been proven to be better. And so you're always learning new things. The other thing, though, that I think most people find to be one of the more challenging things about the nursing profession is that you do meet people maybe at the most difficult times of their life or at the happiest times of their life, right? That's always a major difficulty in the profession, that you're with people sometimes when they get most difficult news they've ever received, and just being there to support someone through those difficult times.
What has been the most valuable life lesson or thing you've learned from your career so far?
Well, one of the things I love about nursing that I think is valuable for people to know about it is that it's a really kind of dynamic, flexible career. I mean, people could start out in labor and delivery delivering babies, and then they could work in an emergency department or an ICU, and then they could work in an outpatient clinic like the stroke prevention clinic. I think that's one of the interesting things about it. It's just a really dynamic profession where you can continue to kind of pursue your passions and do different things, whereas like a doctor who trains in labor and delivery, for example, will always be a labor and delivery doctor.
I did not know that. That's quite interesting. So what education did you do to become a nurse?
For myself, I did 4 years of an undergraduate degree. I went to University of Western Ontario in London, and then 12 years later, I went and did a master's degree at University of Ottawa.
Wow.
So the role I've been in with the stroke prevention clinic is called a nurse specialist role. What that usually means is that you do have a master's degree training and kind of some extra skills in terms of education and research and things like that to kind of look at the quality of programs delivered or other things. So it gives you some additional skills to kind of look at the way healthcare is delivered.
Is your career what you thought it'd be when you started, and are there any expectations that turned out different from reality?
So when I started nursing, I don't even know that I knew exactly what to expect. Like in school, we did probably like 5 different placements. I worked in a lot of different areas, but I feel like nothing prepares you for what you're going to do until you're there a little bit.
Yeah.
One of the things I did that was helpful was I did some extra volunteer work when I was in university. I went and I volunteered in a brain tumor clinic with a nurse and a physician, and that gave me like more insight into, I don't know, just the way that area was working at the Children's Hospital. And then when I graduated from nursing, as many people expect to be able to get a job, that wasn't the case for my year. It's a little bit like teachers where there's a lot of jobs and then not a lot of jobs.
Yeah.
Nursing goes through a similar cycle. So I never imagined I was going to go work in the United States, but I was in Canada a year and I didn't have a full-time job and I wanted to get my skills. So I decided to take a job and I went and I lived in Virginia for 3 years.
Oh, wow.
And the American health system, from my perspective, I was in a public hospital, so we didn't, like, everybody got the care they needed.
Yeah.
You didn't have to turn anyone away like you do sometimes at their private hospitals, so that part felt like Canadian healthcare. But I would say that it was a bit unexpected to have to go and work out of country, but I loved it. They had a really great mentorship program. I worked with a lot of really nice people, and the unit I was on, everyone's really dedicated to the care we delivered, and it was a really great place to start out my career. So that was one of the unexpected things.
Yeah. I did not know you could work outside of Canada for nursing.
Yeah, a lot of, I would say, I think like 3 of my classmates got full-time jobs and the rest went and did other things. So some people went to Ireland, a lot of people went to Arizona or Texas to do, like some people did what's called travel nursing where you're employed by an agency. I went and got hired by the hospital itself in the States, but you had to write a special exam to work out of the country. But at the time, the States was really desperate for nurses and Canada wasn't. When I came back 3 years later, there was like, they were crying for more nursing help. So it was just somewhere along the trend of having too many nurses to all of a sudden not having enough.
Yeah.
When I came back, it was easy to get work.
How do you make a memorable impact?
One of the things I like about the Ottawa Hospital is that its vision is to treat patients the way we would want our loved ones cared for. And I feel like that philosophy makes a memorable impact because when I meet someone who's like my grandmother's age or someone who would be like my sibling's age or what have you, I just think like, what would I want if this person were a family member of mine?
Yeah.
And I try to keep that in mind when I'm taking care of them. So I find just treating people really well, helping them get what they need is what makes things most memorable in my day-to-day. And for some people, that's like just finding out where they're going. For other people, it's a more complicated thing like understanding their health condition. But it's, those, I feel like smaller things. Yeah. Just treating people like humans and being respectful. Yeah. Really makes a difference.
And then I guess going along with that, what would you say makes an excellent nurse?
Yeah, so I would say an excellent nurse is someone who's curious and attentive to detail. It can be things like being a critical thinker, so someone who's really notices small changes in a patient's condition where you're like, this isn't normal. I know half an hour ago they were like this and something's just changed. I think we need to investigate this further. So some of that is just your critical thinking and kind of technical skills and knowing when something is changing or going south, and really advocating for the patient to say, like, I think we need to run some tests here, something's different. But also being good at like troubleshooting, being a good communicator, being a really caring individual matters. Healthcare is all about teamwork, so knowing how to communicate well with your colleagues is important. And nurses do a tremendous amount of troubleshooting. Like at night in a hospital, all the other professionals go home. And suddenly you're stuck with a pump that's not working. You turn into like an engineer for that mechanical failure work. End up, doing things like finding food for people, get hungry off hours, all kinds of things. You just have to be open to being a bit of a jack of all trades.
So nurses are big, like problem solvers and creative thinkers.
Definitely, exactly.
Would you have any advice for anyone wanting to pursue nursing?
For anyone wanting to pursue nursing, I would encourage you to try to volunteer in any sort of healthcare environment just to get your feet wet and kind of understand how things work. I think that's one of the best ways to learn a bit more about, is this really for me? What do I like about it? What area might I like to spend more time in? So volunteering is one way. Talking with friends and family. If you have people who are nurses in the family, talk to people, find out their experiences. Like a project like this is awesome.
Thank you.
You're talking to people across a lot of different sectors and you're finding out a lot about the profession just by talking with a handful of people. So I think those kinds of things are great too, because you get the insider information.
For sure. So I have some student questions from students.
Sure.
So the first one is, why did you choose nursing over other healthcare professions?
So for myself, I have a brother who spent a lot of time in hospital when he was younger. And it was the nurses who I always saw at his bedside. Like his physician would come and go. But nurses were there and they would make him laugh and, distract him from other things that were going on. And I just really enjoyed the relationship that nurses had with the patients they were interacting with. So I would say nurses are just the professional that I saw the most and spent the most time with, but also, just were inspiring to me for what they could bring to his situation. Yeah.
That's really sweet. So the role models and you saw in your life, sort of.
Yeah, exactly. Yeah.
That's very sweet. Another one is, as a nurse, do you find it difficult to watch medical shows like Grey's Anatomy?
So to be honest, I loved Grey's Anatomy. And honestly, over the years, sometimes, I know Grey's Anatomy kind of takes things
yeah.
some, but every now and again, something would happen in the hospital where you were like, I would never in a million years have thought something like this could happen. So, all kinds of strange things occur.
Yeah.
Whether it's people coming in on Halloween night dressed in costumes. Or, people who, I don't know, have, something that, enters the room in one place and exits another, and you think, oh my gosh, is this for real? These things actually happen in real life. So sometimes it's a dramatization. Sometimes you're like, wow, that actually happened. I can't believe I just saw that. And then, the love stories, of course, from Grey's Anatomy are a little bit of a stretch.
Yeah.
I feel like the hospital environment is a place where people become like family. You become really close because you work together for 12 hours at a time. And you do get to know people in an interesting way when things are a bit chaotic. And so a little less on the love drama.
Yeah.
Good relationships with your coworkers, for sure.
And then, are there any periods of the year or times of day that are the busiest?
So I would say that not exactly. I think in emergency departments, maybe they have kind of peak times of day. Most other units are kind of hopping all the time. I always think it's interesting, though, for Christmas, Halloween, times when people have to be at the hospital and everybody's a little bit down because they're not home with their family. Those are times staff actually step up, make the unit festive, put on a Christmas tree, play music, dress up. I actually kind of enjoy that aspect, that people kind of band together and make the
Yeah.
best out of it.
That's really sweet. I like the Christmas trees. That sounds fun.
Yeah.
Do you
it is
decorate
fun.
them?
Yeah, exactly.
I love that.
Yeah, so at night, the lights are all down while people are sleeping, but you kind of have your Christmas tree glowing on the unit and things like that. It just makes it feel like you're making the best out of a difficult situation to kind of celebrate, even if you're not home.
And then, I guess, do you have any final comments or things you'd like to say?
Maybe I just encourage people to consider it as a profession. I think nursing's really interesting. It continues to kind of reshape itself, but healthcare is always changing. It's really interesting, and certainly give it some thought.
Thank you again to Sophia Gocan for that amazing interview about a career in nursing. If you want to listen to this episode or others like it, you can listen here on CKCU 93.1 FM or wherever you listen to podcasts.